Global Fund obviously has funds to fight AIDS, tuberculosis and malaria. And visiting former President of the United States, President Bush's initiative supports the Pink Ribbon, Red Ribbon initiative, which yesterday signed an agreement to collaborate on programming to prevent cervical cancer. Here to tell us more about the Pink Ribbon, Red Ribbon campaign is the CEO, Ms. Celina Schocken, who's come all the way from Washington, D.C. Good morning, ma'am, and welcome to Namibia and to our program here this morning.
Good morning. It's such a pleasure to be here.
Okay. Obviously, just in quick context, what brings you here?
So Pink Ribbon, Red Ribbon was launched about 5 years ago, and we were really excited to launch Namibia yesterday as our 5th country where we're working to address cervical cancer.
Okay. What have been some of your achievements? And I was looking over your website, and it seems like you've reached a few number of people. You've reduced the infections of cervical cancer. So tell us what have been some of your achievements prior to coming to Namibia.
Sure. So cervical cancer is a really interesting disease because it's completely preventable if you can catch it early. And women who are HIV positive are about 5 times more likely to develop cervical cancer. So what we're really trying to do is get women into screening very early so that we can find them when they have very treatable lesions. If we can do that, the treatment is very inexpensive. We've been able to screen 400,000 women for cervical cancer. And we've also helped to vaccinate 120,000 girls for the HPV virus, which causes cervical cancer. Okay. And so we think that that is not only impacting those 120,000 girls from getting cancer, the 400,000 women who we've screened, but we're saving lives that affect many other children, the children of these mothers, these women, and all of their families and their communities.
Let's talk about the nature of your agreement here in Namibia. Again, what's the objective of it?
So we are going to be working here in Namibia with funding from PEPFAR, which is the U.S. government's AIDS program. And we also signed an agreement yesterday with the Global Fund to fight AIDS, tuberculosis, and malaria. So here in Namibia, we're going to be working in the north of the country, as well as in some other parts of the country, to get women screened for cervical cancer and treated for cervical cancer if they have it. We're also going to be helping the government to introduce the HPV vaccination program. So we're really excited about that. But one of the best parts of what we did yesterday was we signed this agreement with the Global Fund where Pink Ribbon, Red Ribbon will work with the Global Fund to help countries access funding. Namibia is the first place where we will work on that, but we're also going to work in several other countries so that we can greatly increase access to screening and treatment for cervical cancer across Africa.
Okay. You're talking a little bit about vaccinations. I mean, do people, I don't think people get the urgency of the situation. So can you, again, just maybe give us some context towards why this is such an urgent intervention, especially with regards to things like HPV vaccines that are being introduced?
Sure. Cervical cancer is a fascinating issue because it kills about 270,000 women a year, and it's completely preventable. So in many countries, they've been able to cut the mortality rate to very, very few, just a couple of deaths a year. So it's an extremely preventable disease. It's caused by the human papilloma virus. That is a very common infection that men and women can get, and it takes a very long time, usually about 10 to 15 years, from the time one is infected with HPV until it turns into cervical cancer. And that creates a lot of opportunities. First, to vaccinate girls from getting this infection, but then also to make sure that their mothers and that women have been screened and treated for this disease. So the costs are really low, and it's a very effective intervention for public health, and yet very underfunded, and so we're really excited about what we're doing here so that we can raise awareness and get the programs moving very quickly here in Namibia.
Maybe you can just give us a brief background in terms of the other 4 countries you've been in. I know Ethiopia is one of them. And what have been some of because people talk about how interventions lead to transformation, whether it's in the health sector and how that obviously affects the household in terms of its well-being.
Yes.
So what have been some of the transformative aspects in the other countries where you have done them, these interventions?
Sure. So we've been working in Ethiopia, Tanzania, Zambia, and Botswana. And then we're now introducing Namibia, and we're also going to be launching a program in Peru later this year, which is very exciting. And what we found is that this is very empowering to women. This is a disease that has a lot of stigma. There is real fear from people about getting this disease. And so what we want to do is to destigmatize the disease, to say that there is treatment available. And it's very similar to where we were with HIV. perhaps 10, 15 years ago, where people didn't want to come forward to be tested for HIV because treatment wasn't available. And when treatment became available because of the hard work from governments like Namibia, from the Global Fund to Fight AIDS, Tuberculosis and Malaria, from PEPFAR, from many partners, it suddenly made sense to come in to get tested because treatment was available. And that's what we're trying to do. And that's what we're starting to see in the countries where we work, where women are coming in earlier. And when they come in earlier, they're much more able to be treated.
In conclusion, obviously, former President George W. Bush, as well as former First Lady Laura Bush, are in town. How significant is their involvement in this project in terms of creating access towards HPV, and how has the experience been of Namibia in conclusion?
Sure. So it's really exciting to work with President Bush and Mrs. Bush, and they're so passionate about this. I'm always amazed by how well they understand this issue and how much of their time and resources they want to commit to addressing cervical cancer. And having their passion, being able to speak about this issue at their level of leadership, because President Bush did so much for HIV and AIDS in Africa and around the world. He raised public health as such an important issue. So having him take on this issue of cervical cancer is very helpful to Pink Ribbon, Red Ribbon. And I think his leadership in Namibia, where he was to work with the First Lady yesterday, and they talked a lot about the role of women and girls and the health of women and girls being such an essential part of Namibia's development. So they had a great visit yesterday. We visited a school. We visited Windhoek Central Hospital. We had a great dinner with the President and with the First Lady yesterday. And I think they've really taken away that such an excitement about what's happening here in Namibia.
Okay. Thank you very much, Mr. Schocken, for coming in, and all the best with the rest of your time in Namibia, and the best hope for your intervention that you're conducting here in the country.
Thank you very much.
Well, maybe there you have it. That is the CEO of the Pink Ribbon, Red Ribbon Initiative, Ms. Celina Schocken, that's talking to us about the intervention and the signings of the agreement that was between the Global Fund that fights tuberculosis, HIV, as well as malaria, leprosy included there as well. But, they will be talking about cervical cancer and how they're going to introduce or prevent HPV.